Hello, good morning. My name is Dr. Thessica Antoine Reed. I am the Medical Director of Clinical Microbiology and Immunology at the Metro Health Medical Center in Cleveland, Ohio, and I'm also an assistant professor at Case Western Medical School. Today, I'll be talking to you about a topic that I think has impacted every single one of us in this audience, and it's the COVID-19 pandemic. But specifically about lessons that I learned as a laboratorian, as an unseen hero. And these are just lessons that I picked up either from technologists, from medical directors, or from my department chair as I helped to aid in our pandemic response. So if a picture were worth 1,000 words, this one would probably be worth 1,000,000. There's not one person in this audience that sees this picture and doesn't know what it is. We've all been impacted by it very intimately, whether it's from us tilting our heads back to get tested personally, or whether it was from receiving bags full of specimens to be tested. One picture has fundamentally changed the way we look at testing and the way that we look at our world in this pandemic. And so throughout this talk, I will tell you my personal lessons learned from working with this picture above. So the first thing I learned when addressing this pandemic is that we needed to find the experts. Initially, when there's a novel virus, that we've never seen before, the problem is we don't know how to diagnose it. And one advantage of working at a medical institution is that there are scientists that spent their entire careers working on an opportunity to present a testing for this. At Vanderbilt, we had a unique opportunity or a unique environment where we had scientists that were working specifically on this virus. And when reagents, specifically primers, were not available, we were able to go to them in their laboratories and get primers so that we could start our testing. This allowed us as a big medical institution to test within the Tennessee area. It tremendously impacted how we were able to respond to our patients and also our community. The second lesson I learned, and I thought this was the most important, was learning our priorities or prioritizing testing. Generally, within the early stages of the pandemic, there were hundreds of specimens coming in at a time, but very limited amount of staff that were able to work on it. So what does that mean? That means that we were either bringing staff over from other parts of the lab, or we had to send out testing that may not have been so high on our priority list. And this is something that I feel 2 years later, I'm still having to deal with. How do I prioritize testing? How do I prioritize patients? How do I determine what stays in-house and what goes outside for outsourcing? And of course, when it comes to priorities, it has to come down to dollars and cents. We have to figure out from a lab perspective, what is the cost benefit of keeping these specimens in, or what will be the impact of sending it out? And while this isn't a decision that many lab directors can just make on their own, of course you have to bring in operations and your management team to help you make these decisions. It's a process that I think everyone in this audience should be very familiar. If a pandemic were to ever occur again and your lab was pressed for time, pressed for reagents, or pressed for personnel, would you specifically know which tests you could send out without causing patient harm to your population and without delaying results in any form or fashion? The next one, and I think this is probably my favorite, is cross-training. And I say when it comes to cross-training, this is a process that is highly effective but underutilized within our laboratories. Prior to coming into the lab, I realized that there might have been this silo that existed pre-pandemic. You had your microbiology lab, and then you had your immunology or molecular lab. Now, the problem that exists with these silos is that while both of these labs may do different testing, they may have the same instrumentation, meaning your techs could be possibly familiar with how to use this, but may not have ever used this particular assay. Now, the issue that happened with the pandemic is that there were tons of specimens that needed to be tested. However, the staffing was limited because a lot of labs run on a lean system. And when this lean system was not serving us well, we realized that cross-training might be the answer to this problem. And so what we did in our institution is we initiated a volunteering system. And in this system, technicians that may have worked in a completely different part of the lab but had basic knowledge on how to utilize these instruments were allowed to volunteer, undergo training, gain competency, and aid in our response. Not only did we find that cross-training was helpful, we also found that postdocs and research scientists who are PhD level could also aid in our response. And the training of them would be the same. You initiate your competency, make sure that they check off all 6 levels, and once you find that they are competent, because they are PhD level, they're able to conduct this test. We found that this kind of saved our institution on times or on different tasks where techs might have been burnt out. We found that we were able to find relief in this method. This picture is probably my absolute favorite, and it says, when reagents and supplies run out, make your own. There was nothing more challenging than the message that went out that said VTM was limited. I think every single person that worked on the COVID pandemic, when you received the message that there was no VTM, you immediately kind of went into this nervous mode. What are we going to do? How are we going to test these patients? At Vanderbilt, there was a unique situation. Pictured here is Mr. Howard. He'd worked at Vanderbilt for 60 years, and what he is holding is his 60-year-old lab notebook with a 60-year-old recipe to make VTM. How did this come in handy, you may ask? Well, as soon as we realized we could not gain access to VTM, immediately he pulled out this notebook, assembled a team, and started making VTM for us. And at first we thought, we don't need to do that. That's completely unsustainable. When we realized that VTM was not available, we figured out a way to make it a sustainable process. We had people sign up for different shifts, learn how to do the QA to ensure that it was appropriate, doing the proper sterility testing, and then send them out. I honestly say of all my heroes that I worked with, he's probably my favorite because he kind of really did save the day. Can you imagine trying to test patients without VTM? I know a lot of people did a quick pivot, whether it was validating other specimen sources like saliva, figuring out, how much or how little these dry swabs could test. Whatever you did, I'm sure you were creative, and I'm sure the property quality standards were in check. But this is one of the things that I think we never envisioned, making our own VTM. And I think this is probably one of my lessons that I'll take with me moving forward as a director. Never be afraid, if the reagents are possible and if the people are possible, to put my own supplies together. And lastly, but the most important, is always remaining flexible. I don't think I've ever been as flexible in thought as I was during this pandemic. Whether that was validating multiple instruments, never knowing where allocations were coming from, realizing that one day I could have reagents for this machine, and tomorrow my team would have to switch to a completely different testing mechanism, and encouraging them to just follow me along this journey. I'm remaining flexible with my personnel, understanding how hard they had been working. I don't think I had ever been that tired before. As a matter of fact, I can't remember a time outside of grad school that I had worked so many days consistently, and I'm sure the same is for you. But remaining flexible, I think, allowed us, whenever we hit a roadblock, to quickly pivot. And I think it's that flexibility, not only in thought, but also in workflow, that has allowed us to come to 2 years later and still kind of be able to look at this and not fully be in shock or trauma. In that, I conclude that every crisis needs a hero, right? But not all of the heroes wear capes. And a lot of times in this crisis, specifically in this pandemic, we saw that there were people who were on the front line, but there were also us in the back. And as those specimens came, I was there with you as we unbagged, as we tried to process them, as we tried to figure out what was the proper regulations. And so if anyone hasn't told you, or if you may haven't heard it in a long time, I just want to extend my thank you to you for all the work that you've done in this pandemic over the last 2 years.